So let's make a start. Slightly ambitiously as well for 10 minutes, going to talk about placing naso-oesophageal feeding tubes in cats today. So I think the first question to ask ourselves is, why and when might it actually be useful to place a naso-oesophageal feeding tube or a naso-oesophageal tube? Let's leave the feeding out of it to start with. So advantages of these are that they are technically easy to place. You don't need to sedate or anesthetize your patient to place one of these tubes. And from a nutritional perspective, a big advantage is that literally as soon as it's placed, you can start feeding. You don't need to delay, which would be the case if you had an animal that you'd anesthetize for placement of an esophagostomy or gastrostomy tube. So some very quick, important initial advantages there. It's still possible for the patient to eat, so that they can still eat whilst this tube is in place, and that's helpful because it can guide us as to when to remove that tube. And they're very useful, therefore, for nutritional support, but also for other purposes, such as preparation for colonoscopy, administration of laxative solutions, for example. Also, in your very constipated, obstipated cat, useful situation there to administer oral laxative solutions, and therefore get a result that avoids the necessity for general anesthesia and evacuation of the feces. But there are some disadvantages, and probably the most important disadvantage, which is hinted at on this slide, is that I've put short-term support for feeding support. And that's because often they're not that well tolerated. So it's not very popular with the cat to have a tube in its nose, to have to wear an Elizabethan collar. They don't generally like having these in place. And so therefore, you may find that the cat tries to and even succeeds in removing its tube. Also, these tubes are very small because they have to fit in a nostril. So that means that you have to feed a liquid food. You cannot liquidize cat food and pass that through the tube. It will block. And that is, of course, extremely frustrating because whilst there are things you can do to try and unblock a blocked tube, things like cranberry extract, Coca-Cola, other carbonated drinks, pancreatic enzymes, all these sorts of things have been suggested. Often the end result of a blocked tube is that it has to be removed. So some very definite disadvantages there. Similarly, I've shown on this slide an example of a kinked tube. So you can see this very soft and flexible tube, which is comfortable for the cat, has just unfortunately kinked just on entry to the nostril. So it's quite hard to actually get the liquid to pass without pulling it out slightly from the nostril and allowing more of a curvature, which then risks it coming out altogether. To allow feeding via this tube, also, you need to have a functional esophagus. So you couldn't use this method of feeding for a cat with esophagitis or megaesophagus, for example. It would be quite unlikely to be successful. That cat's still likely to regurgitate, and that will risk aspiration, but also the tube will come out as well. And it's very common for cats, when you've placed these tubes, to have an ocular discharge the same side of the tube, just due to irritation of the drainage of the tears. So accepting those disadvantages and remembering that there are definitely some advantages for short-term nutritional support, perhaps stabilizing your patient for placement of a more permanent feeding tube. How are we going to do this? Well, our shopping list of equipment is a tube, which ideally should be soft and flexible, and you want to choose a tube that is as large as possible for that cat's nostril that will fit through. So in a Persian cat, typically you will have to use a smaller diameter tube to a Maine Coon, but you do want to choose the largest one that will comfortably pass. You need some lubricant gel, some topical local anesthetic, and then to check tube placement, you need an empty syringe and a syringe containing 5 to 10 mils of sterile water. And then to fix your tube, you need some suture material and tape, or some super glue to use with your tape. The gloves are to stop you sticking yourself to the cats if you're using super glue. An Elizabethan collar afterwards to help prevent the cat from being able to remove the tube. And then, of course, your patient. And the very photogenic example I've used in these slides is a cat called Withiel. So the first step is to anesthetize the nostril. I am right-handed, so I find it easiest to pass a tube through the left nostril. And to anesthetize that nostril, I will use some topical local anesthetic, and I usually use one that's designed for ophthalmic use, so proximeticaine. Just put a drop or two into the nostril, also applying to the surface of the nostril. And what you will notice is that when that is applied, the cat will typically salivate a little and may express some, I'd say, mild disgust at the taste of that local anesthetic. So it's obvious that it has drained back through the nostril to the pharynx. But after that initial reaction, the cat will typically not react to subsequent drops of local anesthetic. And it works very rapidly within a couple of minutes. So if you just reapply or drop or two every 30 seconds or so, you can then tell by gently touching the nostril whether or not the cat is now anesthetized, and you can pass your tube. And all the time that that's happening, so whilst you're waiting for the nostril to become locally anesthetized, you can get your tube ready and measure your tube to about the 8th to the 10th rib, which is where you want it to terminate. You want this tube to end in the esophagus, not in the stomach, because if it goes all the way through to the stomach, then there will be a higher risk of gastroesophageal reflux, which may cause esophagitis, discomfort, and further complications. So you want your tube to end in the distal esophagus. And so you can measure with your tube, you can place some tape or a mark on your tube to guide you as to how far to pass it. The next step is to just put a little bit of lubricant gel on the tip of your tube, and then holding your tube as far away from the tip as you can, whilst maintaining directional control of the tube, you then want to pass that tube into the cat's nostrils. So typically what I'm talking about here is holding the tube about 5 centimeters from the tip if you can. And the reason for that is that if you hold the tube closer to the tip, then what you will find is you might get a little bit into the cat's nostril. They will then move their head and that tube is instantly out of the cat's nostril, and you end up with this sort of yo-yoing in and out of the nostril and not actually getting it in fully. If you have a length of tube of about 5 centimeters, then you can sort of launch very gently that tube through the nostril, aiming ventrally and medially, and you get so far through that the cat, even if they move their head, the tube does not come out, and that gives you the opportunity to then quickly pass it down into the esophagus. And for most cats, it's just that initial bit going into the nostril. I would think probably because of the visual of someone approaching your nose with a tube, which they find a bit off-putting and they're likely to try and move away from. Once you've passed down to the esophagus, and in actual fact, most cats will be quite comfortable and relaxed about the procedure. Their nose is still anesthetized, and you can give them a little bit of a break, as we have done here with Withiel. You can see not looking absolutely impressed with the whole procedure, but also not making any attempt to remove that tube. And then this gives us the opportunity also to confirm that we are in the esophagus as we wish to be. So the first part of that step is to attach our empty syringe to our tube and suck back to aspirate. And if we're in the esophagus, then when we aspirate, we should find we get very little or no air at all. It should essentially be a vacuum, because the esophagus, unless there is a megaesophagus, is empty of air, and you then will just collapse that tissue onto the end of the tube, hence getting no air and just a vacuum in your tube. And then, having successfully done that step, the next step is to get your tube with some sterile water and to attach, your syringe with your sterile water, and attach that to your tube and gently flush through the tube and monitor your patient. And what should happen typically is that nothing happens. The cat just sits there and looks at you. Sometimes the cat will swallow, and you will actually see that. And sometimes you can hear a little gurgle in the stomach as the water goes through into the stomach. But what, of course, you're looking for and listening for is any evidence of the cat coughing, which might indicate your tube is in the wrong place, is in the trachea. That is extremely, extremely unlikely in a cat like Withiel, that you can see mentally, neurologically looks completely normal. So you would only be worried really about, I think, passing into the esophagus inadvertently in a cat that's much more sick, very debilitated cat, or if you're doing this procedure under sedation, for example. And so hence this comment on the slide that you can confirm correct placement of your tube by taking a radiograph to check that you are absolutely certain that the tube is in the esophagus. And that is absolutely essential if you're doing this procedure in a very sick cat or in a sedated cat or anesthetized cat. And then lastly, once you're happy that the tube is firstly in place, in the right place, and also at the right distance down there, so you've pre-measured your tube, you can then fix it to your patient, either with a suture or with some topical super glue, which is in some quarters, I think, considered a little bit cruel, but has been a traditional option that many of us, including myself, have used to fix that tube, the tapes attached to the tube onto the cat's fur. You will often find that the fur does drop out over that area, so little bald patches do develop post-tube removal. And then we can move on to the next step, which is place ideally a nice, soft, comfortable, flexible Elizabethan collar, so not as modelled by Withiel, but something similar to the picture on the right-hand side would be preferred. And then instantly we can start feeding, and that's the great advantage of placing this in a completely conscious cat. From a feeding perspective, we do need to stick to the liquid foods. So something like the Royal Canin recovery liquids are ideal because they are formulated for tube feeding, and you know that they are not going to block your tube. But there are other options. So for example, we can mix tinned Hill's AD with some water to make it more watery, and that will pass down a tube. Or we can use the Royal Canin convalescence powder, again thoroughly mixed with water, or other options like Eukanuba high calorie diet mixed with water and pass down the tube. But a great advantage of those diets that come as a liquid is that you know you have, I think, more reassurance that you're not going to get any blockages with these small tubes. So the next step, having decided which food we're using, is to calculate how much of that are the daily requirements. And this patient, Ralph, is a cat with pyothorax who is very sick, too sick to be anaesthetized for placement of an esophagostomy tube. So we initially passed a naso-oesophageal feeding tube to support him. And he weighed 2.8 kilos. So his resting energy requirements are 152 calories, which very conveniently with the Royal Canin foods is 152 mils. So the next key thing is really that we don't want to feed our total daily requirements straight away. That can be a bit of a shock to our anorexic cat, very likely to be associated with gastrointestinal side effects in particular. So what we typically recommend is that on day one, you feed a third of the nutritional requirements and you make up the rest of the volume, so that 152 mils, with water. So water flushes either side of a small meal. And that also you feed several small meals a day. So 4 to 6 meals a day would be typical for this. And if you see any signs of nausea, the cat starts to salivate or vocalize or look uncomfortable, then stop that meal, because that may indicate that they just are finding it difficult to cope with food in their stomach, having been anorexic for some time. If all goes well on day one, then you can increase on day two to 2/3 of the nutritional requirements, and day three, the full nutritional requirements, and take it from there. In summary, these tubes are straightforward to place. They definitely have a role, I believe, particularly for very sick cats, where even if we think this cat will need long-term nutritional support, if we're worried about anesthetizing it today for placement of a more long-term indwelling tube, such as an esophagostomy tube, we can do something short-term that will really help to improve our patient's clinical status and get them into a better state for anesthesia, perhaps in a few days, if we still think they're going to need that long-term appetite support, nutritional support. So very, very helpful in the short term. And also I put a note here that for some cats that really hate the tubes being left in them, they actually will tolerate having a tube passed several times a day. So although that sounds in some ways worse for the cat, having to place a naso-esophageal feeding tube several times a day. I have had some patients where actually they tolerate better having 4 placements a day with the tube just taken out completely afterwards than having a tube indwelling. Something I forgot to mention on the previous slide as well is just that we should warm the food before we put it down the tube to just below body temperature, so that it is not cold going into the body. And I think that probably is enough to say for now, other than that next time, in 2 weeks' time, we'll talk about esophagostomy tube placement, which I think is extremely helpful for the more medium to long-term support of those cats that need nutritional management. Also, a reminder of the resources that are available on the website, many of which are free to access. The helpful info menu is probably the most helpful one because it has free downloads, the technical guides, but also the video tutorials page, which has recordings of all the previous 10-minute tip sessions and other free to access webinars as well. So lots to look at, lots to get from that, which I hope will help you in your clinics as well. And very lastly, just wanted to plug a few surveys that we have open at the moment, and in particular 2 surveys that we have open on telemedicine. This is where we are doing a consultation over the phone or via a video consultation using Zoom, for example, or perhaps even email. Basically anything which is not face-to-face in person is telemedicine. And we have 2 surveys, one for veterinary professionals and one for cat owners. And we're particularly interested in people's experience and views on the use of telemedicine for feline patients in our current COVID era, and would really, really appreciate you not only filling in these surveys for yourselves, but also sharing with colleagues, and also, of course, the cat owner one, sharing with your clients. And we do have some information on our Facebook page if easier to share in that way. So really, really would appreciate your support. Thank you very much for choosing to listen, and I will now be very happy to answer any questions. I'll start by looking in the chat box, and then feel free to either unmute yourself or enter further questions. Thank you very much.